Thank you for joining us. Welcome to today's presentation on the Incident Command System. The Ketchikan Emergency Operations Center, or EOC, is working hard to keep Ketchikan citizens safe and informed. This program is a brief introduction to the Incident Command System, or ICS, for local Ketchikan stakeholders as we all navigate COVID-19. If you have any questions about this emergency response structure after watching the video, please use the links and phone numbers provided in the description. Before we get into the mechanics of ICS, it is important to note a few things. Whether you are a member of the public looking for answers about how the response is being run, an elected official, or a professional who is working within the EOC, it is essential to recognize that we are all on the same team. In order to effectively flatten the curve of this virus, we all need to do our part and keep our cool. Please speak to everyone working on this response with the same kind of respect and thoughtfulness that you would want to be given. Emotions are high because everyone wants to mitigate the effects of this virus on our community. When you go out in public and engage with others, just remember that they love Ketchikan too. Today we're going to talk about how multiple agencies across the public and private sectors can work together to conduct an emergency response. At the end, there will be some tips on what you can do to help and where to find more information. The National Incident Management System, or NIMS, is the universally recognized system for managing emergencies and dynamic or unpredictable events. It includes the Incident Command System, or ICS, which governs the way in which stakeholders with jurisdiction and authority come together to make effective decisions. NIMS is organized into three major components: resource management, command and coordination, and communications. ICS was originally developed in the 1970s to coordinate multi-agency responses to wildland fires. It has evolved over the last 5 decades to become the most trusted way to respond to an emergency. ICS is used in the U.S. and internationally to fight fires, clean up oil spills, recover from earthquakes, and more. It is even used to manage massive live events such as the Macy's Thanksgiving Day Parade and the Super Bowl. The basis for ICS is simple. To coordinate professionals and experts from different backgrounds, we must all first agree upon our objectives. This allows us to develop a functional organization and provide personnel from different agencies and with incident-specific roles and responsibilities. They are equipped with tools and training. The structure of ICS allows the organization to establish healthy lines of communication and procedures for accountability. You might ask why the Ketchikan EOC is using ICS to manage our local response to COVID-19. ICS helps us to clarify the chain of command during critical operations. It also allows us to leverage community-wide resources and communication platforms to help keep people safe during this time. ICS is identified in the state of Alaska and Ketchikan emergency plans as the best way to coordinate our efforts. ICS helps us ensure the safety of responders, community members, and others while using our resources to their highest efficiency and effectiveness. To start, let's talk about a few key concepts in ICS that have been tested over thousands of incidents across the U.S. over the last 5 decades. The chain of command structure is the hierarchy of decision makers within the ICS structure. An individual has a chain of command both up and down. Critical information is shared up, down, and within each team. If an individual within the response needs to step away from their duties for any reason, their role and authority may temporarily or permanently be delegated to another qualified person. Jurisdiction and authority are how members of the EOC are selected. Jurisdiction refers to the ability to make decisions for this geographic area or within the subject matter area, health and safety. Authority refers to the ability to spend money and allocate resources. Subject matter expertise refers to a person with expert knowledge in a relevant field, such as medicine and healthcare, emergency management, public services, and law enforcement. Span of control is the key to good communications and accountability within the organization. Teams are no more than 7 people, ideally 3 to 5 people, with a team leader or supervisor designated for each group. This means that there is only one person giving direction at any given time, and within the chain of command, it provides a direct line of authority both up and down. Having a tight span of control ensures that there are no mixed messages or directives for the teams to get their job done. When personnel need to work remotely or in virtual settings, it may make sense to limit team or work group sizes. An incident command post or emergency operations center is the place where plans and decisions are considered for use in the response. The command post can be physical or virtual, but needs to fulfill certain requirements to make sure that personnel have access to the resources, information, and communication infrastructure they need to do their job. To limit the spread of the virus, the Ketchikan EOC is currently operating in a virtual environment. Leveraging technology helps to keep the EOC personnel safe and in compliance with CDC guidelines. Using tools like Basecamp, GoToMeeting, and email, we can maintain a strong common understanding of the response objectives, strategies, plans, and problems yet to solve. KPU is also helping the response with telecom and media support. However, this virtual environment presents challenges as well as safety and efficiency. The EOC is staffed by professionals and experts from multiple agencies with different devices and capabilities. Some of the EOC staff may be working remotely from their homes while their day job, families, and children, and the stress of this outbreak are all making demands on their time. For those reasons, it is a very different experience than working physically side by side in a command post. The EOC instituted a daily meeting schedule by teleconference to ensure that communications flow freely and adequately between personnel. The EOC is also staffing backup and deputy positions to allow personnel to take breaks when needed, as these jobs are demanding even under better circumstances. Now that we have some key concepts down, here's how an ICS organization functions. In ICS, there can be an incident commander and a unified command. An incident commander for an event like this is typically predefined by local and state authorities. Unified command refers to a group of approximately 3 individuals who have the highest level of jurisdiction and authority for this response. The unified command works to set the incident objectives, strategies, and priorities, and has the ultimate responsibility for managing the incident. They make decisions in consensus, and when a consensus cannot be reached, the person formally recognized as the IC, or incident commander, breaks the tie. The command staff report directly to the unified command. The safety officer is responsible for safety of all personnel in the organization. The safety officer communicates to the organization through safety plans, daily shift briefings, and may conduct on-site monitoring during operations. The public information officer is responsible for communicating clear and essential information to the public and responding to questions and interest from the media. The liaison officer is responsible for coordinating with elected officials, stakeholders, and key response partners. The liaison officer answers questions for these important stakeholders and also functions as a conduit for those stakeholders to provide input to the response. All of these command staff positions may have deputies, assistants, and even teams working with them to achieve their objectives. Subject to the objectives, and priorities of the Unified Command, an ICS organization is divided into 4 sections. Operations directs all response and tactical actions to achieve the incident objectives. Everything being done by healthcare providers and emergency medical personnel to assess, test, and treat possible cases of this virus is within operations. Planning supports operations by developing plans, tracking resources, collecting and analyzing information, and maintaining documentation. Logistics arranges for resources and services to be delivered in the most rapid and effective way. This includes response personnel and facilities as well as equipment. Finance and administration monitors the costs related to the incident. This includes accounting, procurement, timekeeping, and contracts. In this response, there is also a policy group that advises the Unified Command on important policy matters. The policy group is made up of senior executives and elected officials who meet with the Unified Command regularly, typically once per operational period. There are a number of agencies working on this response currently, and more that may yet become involved. Your own employer may even be working on internal controls to keep employees safe, helping to reduce and eliminate virus transmission. Current response partners include our robust local emergency response community, law enforcement, medical facilities, schools and community organizations, state and federal agencies, CPRO, the United States Coast Guard, transportation services, and more. The person in charge of operations is called the Operations Section Chief. The Operations Section Chief directs a team of people to implement strategies and tactics that meet the objectives, support development of plans to ensure that they reflect current operations and capabilities, and organize response resources. The medical providers doing the critical fieldwork of assessing, testing, and treating possible COVID-19 patients are within operations. The person in charge of planning is called the Planning Section Chief. The Planning Section Chief directs a team of people to develop relevant plans, maintain a high degree of situational awareness across the organization, track resources, document incident decisions, and develop the Incident Action Plan. The Incident Action Plan is a document that includes all of the planned response activities for the next operational period. Planning staff include the Resource Unit, Situation Unit, Documentation Unit, and any technical experts that have been brought in to help develop plans. The person in charge of logistics is called the Logistics Section Chief. The Logistics Section Chief directs a team of people to order, stock, and account for personnel, equipment, and supplies, establish communication mechanisms, set up facilities and supplies to support response personnel, and provide other support functions to response personnel as the situation requires. The person in charge of finance and administration is called the Finance and Admin Section Chief. This chief directs a team of people to perform timekeeping and payroll functions, track and analyze costs, execute contracts, and document activities for possible reimbursement. Planning P is a visual representation of how we plan ahead for each operational period. The incident begins. Notifications are made. In this case, the incident affects areas across the globe and not just Ketchikan, but we will move through this process to give you the fullest picture possible. After an initial response and assessment is underway, the response personnel prepare what is called an ICS 201 form. The 201 is the most basic form in ICS, and it communicates the incident characteristics such as location and scenario, as well as resources that have been activated. The EOC in Ketchikan was activated prior to local cases being confirmed, and the Unified Command began to discuss critical information and objectives. During a response, the stem of this planning P represents all of the initial or unplanned activities. Once the initial response is complete, we then move into a planning cycle. This planning cycle is completed for every operational period. An operational period can be 12 hours, 24 hours, or even a week for a protracted response. If you would like to learn more about ICS processes and the work products that result from them, you can visit the FEMA website at www.fema.gov. You can also take a look at state plans and resources on the State of Alaska website, www.alaska.gov. Everyone should be prepared to do their part. The COVID-19 virus is serious and potentially deadly. The CDC, State of Alaska, and Ketchikan EOC are unified in their recommendations to stop the spread of this virus. Whether or not you believe you are personally at risk, you know and care about people who are. Practice social distancing when possible. Practice proper hand washing and hygiene. You've seen the videos and you've read the flyers. You know how to do it. And finally, remember to read the articles and check your sources before sharing information on social media. You can help your family members and the entire Ketchikan community stay safe by sharing official information rather than rumors. Thank you for listening. If you would like more information about how our EOC functions locally, please click the links in this video description to learn more.